Most insurance agents use this term incorrectly. Credible coverage, actually creditable coverage, if we wanted to pronounce it without the slurring it all together. Credible coverage, they use it in relation to discussions about large employer group health plans, which it does not apply at all. Credible coverage as terminology only applies to Medicare Part D. So let's dig into it a little bit. You want to be a Medicare nerd, pull out your popcorn. So Medicare Part D drug benefits, so let's say I'm getting it through my employer, have to be as good or better than Medicare Part D benefits. That is the definition of credible coverage. As good or better. Now that got all blurry when the Inflation Reduction Act gave us this cap, this year being $2,100. Most employer group health plans do not break out drug costs from their annual deductible. They lump it all in together. So the government's just kicking this can down the road. What they should have done is made every employer in the country break it out so that they can see that they're not going to spend more than $2,100. Therefore, when they get their credible coverage notices, it'll say, you meet the definition of credible coverage. They didn't do that. They'll probably never do that. There's so many other things on their plate. So right now they're just saying, if you have an employer group health plan, does it have 20 or more employees? Now, I get a question a lot of times. They're like, is it 20 or more employees on the group health plan? No. Is it 20 or more employees employed at the company? Yes. Do they have to be full-time employees? No. What if it fluctuates throughout the year? Then we average over the last 12 months. Are we hitting an average of 20 or more employees over the past 12 months? If yes, then even though very few of them are on their employer group health plan, your plan qualifies to delay a Medicare late penalty. So we're all using it wrong. People say, oh, you have credible coverage because you have 20 or more employees. No. This is the Medicare secondary payer rule at play. It's saying if you have 20 or more, Medicare is going to be secondary to your health plan. Your health plan's primary. It's easy to say, oh, you have credible coverage. People kind of have a concept of what that means. And what we use, the way we're using it, is saying you don't get a Medicare late penalty. But I had somebody just jumping my butt one time saying, you got to quit saying credible coverage. And I was like, okay, point taken. So hence the video for you, Stuart. Credible coverage only pertains to Part D, not to your employer group health plan. To make matters even more convoluted, if you have a veteran and the veteran comes to you at 68, he was eligible for Medicare at 65, he did not enroll. And 3 years later, he decides, you know what? I'm really interested in these Medicare Advantage plans, MA only plans built for veterans. My friends have them. They like them. I think I'd like to get one. So he's 3 years late for Medicare Part B. He's like, yeah, but I've been on the VA. I've got all my health care at the VA. The VA is not, I'm not going to say credible coverage. The VA will not help you prevent a late Medicare Part B penalty. So you can still get Medicare, but you're 3 years late, 10% per every year you're late. You'll pay a 30% extra late penalty every month for Part B for the rest of your life. Now, Part D was credible through the VA. So even though you didn't take Part D then, if you do want to get it now, there's no late penalty. Now you're going to say, you just said I'm probably going to get an MA only plan. Well, this year I've noticed more and more veterans, they had an option to get it through the VA, through TRICARE for Life, or through the federal retirees, that they didn't go with an MA only plan. They went with an MA PD plan. So that's why it matters, if they're going with an MA PD plan, that you explain to them that if they are late and they didn't have credible coverage for D, that they're going to see a late D penalty coming out of their Social Security. They shouldn't in this scenario with veterans, TRICARE, and federal employees, because their Part D coverage through those entities was credible coverage for Part D. Their health care coverage did not prevent them from getting a late penalty for Medicare Part B. If you learned something, I would appreciate it if you would please share this with another insurance agent that doesn't understand this, ideally someone young. Hit the comments. Tell me something. Tell me an experience that you've had. Help me with the questions that you're still left unanswered from your video. And please subscribe so you'll learn something next week.